Hello, everyone. Welcome to A Conversation With. My name is Emma Smith, and I'm absolutely delighted to have Hannah Sterzake, I've gone with, from Answer Cancer with us today. So, Hannah, how are you doing?
I'm okay, thank you. Bit of a sore throat.
Oh, I think everyone's got a sore throat at the moment. Or COVID. That's doing the rounds again in our house.
It's not that.
Okay. All right, if you've not been to one of these webinars before, my name is Emma. I'm the project manager with Empowered Conversations, which is a project of Age UK Salford. We've been running these webinars for a few years now. Empowered Conversations deliver communication courses across Greater Manchester for family caregivers and also for professionals. And in Salford, we offer one-to-one support through Empowered Carers. So that's a bit of background about us. We've got a few functions going on today, folks. So we're going to use the chat function when we do a quiz with Hannah. And at any point, Hannah said, at any point, if you've got a question, pop it in the Q&A. And at any point, she's going to pick those up. So normally we save them to the end, but Hannah's not bothered. She's going to just pick them up as they come along. So we'll use the chat function for the quiz, and we'll use the Q&A for questions. And I'm just going to share with you a little poll, if I may. So I'm going to give you a couple of seconds just to do this little poll, just to find out what you know and how confident you are with what you know. She says, having written it all in.
So I'll start sharing my screen. Hi, everybody. I'm Hannah, and thanks for having me. And I'm going to try and share screen, okay? And hopefully it won't mess up any polls or anything like that. Okay. So my name is Hannah, and I'm from Answer Cancer, and hopefully you can see my slide. Is that right? Yeah. Brilliant. Okay, so we can see the quiz now, the poll. So shall I let everybody fill that in for a minute?
Yes, please. Sorry.
Before I start gabbing. It's being filled in, so that's good. Thank you, everybody.
Currently, we're in the middle range on them all. I always answer in the middle. Do you, Hannah? I'm always in the middle.
It's really hard, isn't it, to be put on the spot sometimes and be asked certain questions. Do you know what I mean? And some of the questions you can kind of interpret in different ways because some people aren't eligible for certain screenings anyway. So it's a tricky one. But there are 3 questions, aren't there?
We've got middle. So we've had 3 answer, and so we're middle on or first and the second, and then first and the third, and the middle one is very keen. So before attending the engagement session, how keen were you to attend your cancer screening appointment? So we've had one person who said very keen on that. So I hand back to you, Hannah, for carrying on with the presentation.
Yeah, sure. Do I need to stop this then?
Oh, is it still on yours?
It is. Do I click end poll? You can tell we've not done this before, have we? Oh, and then it's got results. Do you want to see results? Or...
Do you want to have a look?
Yeah. Oh, click stop sharing. Share result.
There we go. So we're sort of middle. We're in the middle, aren't we?
Fantastic. That's great.
If I close that, does it close it off your screen?
It's gone. It's gone for me anyway, so I hope it's gone for everybody else. So. Oh, thanks, Emma.
That's all right.
So coming back to what we are doing today, Answer Cancer is a programme and it's just in Greater Manchester and it's about cancer screening, and it's all about increasing the uptake, the amount of people that actually have those checks, those screenings done. So it says it at the bottom there. There's 4 organisations which make up our partnership. We've got Salford CVS, where I'm based at, we've got BHA for Equality, VSNW, which is Voluntary Sector North West, and you need some more to do with the kind of monitoring and evaluation The whole point of our programme is to reach every kind of person, every age group, well, adults who are eligible, but every kind of gender, every ethnicity, any kind of person, just with this information about awareness of what cancer is, what cancer screening is as well, and who's eligible and why it's so important. So that's basically who we are and what we do. So my role is an engagement lead, and I cover Salford and Bolton and try and meet with community groups, anybody that will have me, to talk about cancer screening, really. It's a hard subject to talk about, so I do apologise beforehand for talking about cancer, because a lot of us have experienced it in some way, whether it's through family or friends, and I think it has a negative kind of emotion attached to it when we talk about it. So I do apologise for that in advance. But saying that, it's still really important we talk about it just to make ourselves aware. And hopefully these sessions aren't to create fear, it's to empower us to know what we can do, what to look out for, and kind of positive actions because of that. So that's why I do this, because it's all about empowering people and trying to, don't know, not nag them, but encourage them to go to the doctors, that they are important, and that going to the doctors is sometimes another route, sometimes the only route to get a diagnosis or to get some kind of further test if you're not due for cancer screening. Well, cancer screening is great, but there's other things we'll be talking about as well. All right, sorry, I do like to ramble, so I do apologise. Get carried away sometimes. So if I said to you, we're talking about cancer, and when Emma put up the message about this webinar, I'm sure it brought to mind a few different things in your head, different words, different questions, different thoughts, different feelings. And for the majority of people, it's negative, like we've just said. So for some people, it's different words. And for other people, it can bring up questions as well. So it's all negative, everything on here, fear, death, sickness, pain, sadness, it's negative. But when we talk about cancer, we do think of questions. It brings up massive questions about life and death, doesn't it? So it is a huge thing, things that we don't like to think about sometimes. It's easy just to carry on and get busy in life, isn't it? And we don't have to address certain things, but sometimes we need to think about our own health sometimes and remind ourselves of, I don't know, certain things that we should be looking out for and being aware of. So what Answer Cancer tries to do is change the narrative sometimes of it being a negative thing to talk about into something more everyday. What I find where I work, people talk to me sometimes about their cancer screenings, and just the conversation about your experience maybe, or oh, I've got an appointment next week, or I've got to book my appointment. That's more the case, isn't it? I've got my letter, I've got to book it, and something else I've got to do. Just talking about it, reminding people, sharing things that can provoke someone else to think, oh yeah, I've got that on my fridge, I've still got to do that. And it's just about talking about it. I think COVID's taught us a lot about talking about things and reminding, bringing up conversations and supporting people in our groups and our friendship groups and other places. So the point of Answer Cancer is to try and do these sessions to debunk any myths, any misbeliefs, any misconceptions for some people who might not even want to say the word cancer because they feel it might happen to them because they've talked about it, and to go through some of the things that maybe we see on the news and to try and make sure we've got the right information, we know where to go for our right facts and figures and things like that. And I would say NHS websites and Cancer Research UK are always amazing, but there's another few charities as well, and they're on the PowerPoint at the end. So for me, I don't watch soaps, but a lot of people during these sessions talk about soaps and what they've seen on soaps, which is soap stories and characters and things, which is great because it, in some contexts, it kind of raises people's awareness of cancer if people use it in storylines. But sometimes it's used as a negative storyline just to maybe get rid of the character. And 40 years ago, cancer was a different kind of illness to what it is today. There is so much treatment. We're so lucky in Manchester with the different satellites that has come on in leaps and bounds, and early diagnosis is much happening much more, and the prognosis is much different now than how it used to be. So for me, the point of Answer Cancer is to just generate conversations about cancer and hopefully give knowledge, give awareness, and make people feel more comfortable with it or talking about it, kind of thing. So for us, it's giving the right information, it's talking about it, and it's also signposting people to support. Quite a lot of these sessions, we talk about Macmillan, who are amazing. You can find their information online in Salford. There's the centre at Salford Hospital, isn't there? There's lots of information there. The people that are going through cancer, but also friends and family. It's practical support, but it's also emotional support as well, which is really important. So for me, for Answer Cancer, it's about these things. It's about talking about cancer and just making it more of an okay thing to talk about. Makes sense. Our messages, there's 3, and these are them. Cancer screening does save lives. Cancer Research UK believe that with breast screening every year in the UK, I think it's like 1,200 lives are saved. I don't know how they work that out, but it's actual lives that are saved because of cancer screening. And I think it's about 1,300 lives through cervical cancer screening. So it's incredible. And that's why we have certain cancer screening programs in this country, because it picks it up early, it's detected, and then treatment can happen, and prognosis is so much better than if it was left or till signs and symptoms happened. So the second point, the second thing we talk about, one of our messages is, if it's unusual for you, do go to the doctors. If we were in a real session, there'd be somebody there who would be heckling me at this point, but I can't get a GP appointment. And that happens quite often in our sessions, and it's really sad, it's really annoying, and it's upsetting as well. You should be able to get an appointment with your GP. The situation with COVID and things like that, it's staying with us. Whatever has changed at your GP surgery, you still should be able to get an appointment. If you cannot get a GP appointment, that's a huge problem, and you should be complaining and speaking to Healthwatch about that. Emma, I'm sure you've had Healthwatch Salford do something with your group, and you've got their information, haven't you? Yeah. I always say they're amazing, because if you've had any negative experience in health or social care, they want to hear it because they want to make it better, and they're an independent body, and they want to hear your views and your experience. To me, it's nice that someone's there to listen as well. It's cathartic being able to tell your story. But as well, it's not just complaining about a situation, it's complaining in the right way, I always say. It's complaining to the people who could possibly make a change, who could make it different for the next person. So Healthwatch, amazing, fantastic. And going to your GP, coming back to this, going to your GP is sometimes the only other route to getting a diagnosis, to getting a test if there is something wrong. What we say at Answer Cancer is, you know your body more than anybody else, because you've had it, you've got it, and you live with it. You know if something isn't right, isn't working, isn't feeling as it normally feels, or doing the same thing. So do take note of it. And when you do go to the doctor, do make sure that you get that across, that you're worried about this because it's not how it used to be, or do you know what I mean? So that's the second point. And the third point is early detection saves lives. So whether you go to the GP as soon as you notice something, or go to your cancer screening, either of those 2 things, if you are doing, rather than sitting back and waiting, or sitting with your head in the sand and trying to ignore certain letters or rashes or things that you've got, early detection saves lives. So it's about us having the kind of knowledge and awareness, but also not being fearful, but knowing there's things we can do. Okay, so we'll do a bit of a quiz, if that's all right. Emma, I'm going to test your technical skills again. I do apologise. I really do.
We saw how good they were earlier, Hannah.
So these are just 6 questions. Normally have people shouting out, so I do apologise for this. If you want to put the answers in the chat, Emma will have a look, and we'll have a look together if I can as well. These questions are just to kind of not look at what you know, but to kind of bring up the topic or the kind of myth, or, you know, the kind of issue maybe that there is. So let's, question 1. So the question is, in England, what, can't see, nothing. What
I'm going to use the chat as well.
Oh, great. So in England, what age are women Anybody registered female invited for a mammogram?
Oh, wait,
Anybody?
do it to everyone.
Oh, thank you. Oh, great. Some good answers.
The prizes, Hannah. Have we got
Well,
Toblerone
this is the
send
thing,
out to
because it's
people?
online, it's really hard. So I could give you some prizes to distribute later on. We have to keep a tally, though, of who said what.
So a
Have to be
virtual
honest.
prize.
A big well done. I'm going to move it so I can see if I've not lost it. So the answer, everybody, is 50. So if you put 50, that is correct. It's 50 to 70, but you can have it sooner. If someone in your family, a close relative, has had breast cancer, you can go to your GP and ask to have it sooner. There's some kind of what they call studies going on where you might be invited earlier as well, from 47 onwards, but it's normally 50. A really important thing here is, as well, is even if you hit 70, you can ring the breast screening number, and carry on having those mammograms as well, because 70 is not old at all, is it? So well done. I think the majority of you said 50s, didn't you? So that's really good. Well done. Next question. What is a mammogram? What is breast screening? So in just one word, what would you say it was?
Well, that's really hard, Hannah.
I know. I've lost my tab bar. What am I doing? Oh, sorry. I clicked.
I'll bring
It's
the
an
chat.
X-ray.
Oh,
I went too far. Oh, there's my bar. Sorry.
diagnostic test.
Well done. That's
So
really
you got
good.
a medical background.
I know.
I was just going, it's this.
That is what it is, yeah.
That's all I know. It's this, because I haven't had one yet. So I just know it's this.
Well done, yeah. It is a diagnostic test, you're right. It is an X-ray, and it squishes your breast on each side, and it's just an X-ray of your breast tissue. So well done. Sorry, I jumped the gun a bit. Next question.
Woodwork clamp.
It might feel like that, but hopefully it doesn't. If it is painful, you do need to let them know, okay? Because I think they can manually adjust it now. So breast cancer is the commonest cancer in the UK. Is that true or false? True. Anybody else? False.
The answer's false. If Claire said it's false, it's false. I've got it wrong again. I think I've got everyone wrong so far. Oh, Linda's on my side. Oh.
Anybody else want to guess? I'll tell you, it is actually true. It goes breast cancer, then prostate, and then lung, and then bowel cancer. Those are our top 4 cancers. It says 3 in 20 of all new cancer cases are breast cancer. Apparently 1 in 8 women will get breast cancer at some point. Now, the statistic for prostate cancer, prostate's just for men, it's a male organ. It's 1 in 8 for prostate cancer as well, but it's slightly less in the whole tally of things. So breast cancer is our top 1. So next question. Can men get breast cancer? Yes or no, true or false? What do you think? Emma, you were super quick on the chat with your answers.
Yeah, because I'm still going for a prize. That's why, Hannah. I've only got one right so far.
I think everyone said yes or true. It is true. Well done. Men can and do get breast cancer. It's about 350 to 370 men a year, but that's just in the UK. So it's exactly the same signs and symptoms, but men do not get breast screens. They don't get the letters for invitations, but yet it presents in exactly the same kind of way. So it's really important when we look at signs and symptoms, men are aware of that too. I think there was
I'm going to ask you now, if we go back to this, how is that even possible on a man? They must have a different way.
That is tricky, yeah. So I think they can do ultrasounds, but I do think if there's some breast tissue, I think from my understanding, I might be wrong, but depending on your age, you will get an ultrasound if you're under 42, and you go with a sign or symptom. And when you're over 42, I think the density of your breast changes. So ladies can have a mammogram, the x-ray. So there's ultrasound and x-ray. Some people get both. Some people might just get one depending on age. But when it comes to men, I do not know that answer. So Emma, I'm going to do my homework now and come back to you if that's all right. But I'm thinking there might be something, because some ladies do have small breasts, and some, do you know what I mean? There might be something that they'll be able to think to get in the machine. But it's really important when we talk about breast cancer, we're aware it's our breast area isn't just the bit that goes in the machine. It comes right up to your bone, your clavicle at the top here, and right under your armpit. So it's that whole chest area. So obviously a little bit of the skin goes in the mammary gland go in the machine. But when we're looking at breast cancer signs and symptoms, we need to be aware of the whole of our chest area too. So moving on from that, so that was true. Then do you get breast cancer? So the FIT kit is the test, this cancer screening, which we use for bowel cancer. But is it actually a test for cancer? So this is a cancer screening kit. It's really hard of me to ask this of you before we've even gone through the session. But the FIT kit is a test for cancer. Is that true or false? It's part of the screening program. When you hit in your late 50s, at the minute it is, you get one sent to your house and you do the kit, and it's for bowel cancer. But is it a test for cancer or something else? Very tricky, these questions, because it's to try and catch people out. So I feel if I explain it anymore, I might give you the answer. Oh, brilliant. Good answers, guys. I think you've got it there, haven't you? It tests for blood, so it's not a test for cancer. You can't detect cancer in the poo. It picks up microscopic bits of blood. That could mean not just cancer, it could mean lots of different issues. You might have strained, you might have polyp, something else going on. It tests for blood in your poo. If it's positive, then you get sent for a colonoscopy, and then that can see more about what's going on. So I would say, coming back to one of the questions earlier, someone said, was it a test? What did the first question ask? It was about testing the area. What did someone say? I can't remember. This is what screening is. It's like a check-up of the whole area. And I think somebody mentioned the terminology before.
A diagnostic test?
Yes. So it is a diagnostic test, but it's about the health of, like, it's a health check, basically, of that area. So when we have a mammogram, it's like the health check of your breast. It can detect other things like cysts and other abnormalities. Likewise, with bowel screening, it detects the possibility of other issues going on in your bowel, not just cancer. And likewise with cervical screening as well, it can pick up other things when the test is going on. So brilliant, it's a health check. And the answer is, it is false. It isn't a test for cancer, it's a test for blood in your poo. So last question, thank goodness. Over 50% of bowel cancer in the UK is preventable. Do we think that's true or false? Emma, you get top marks for being first on all the answers.
For speed, but not for accuracy.
Well, at least type something. Think anybody else wants to comment? No? You want to know? Are you desperate to know?
Is the answer?
It is over 50% of bowel cancer in the UK. It is preventable, yeah. So it's true, well done. If you put true, and the whole point of that, or the whole reasoning behind that, is because some of the risk factors we can control, like food that we eat, because our bowel is obviously our intestines after our stomach, where our food is transported through. So reducing some of the factors like alcohol, smoking, fibre, things like that, or having more fibre, can reduce our risk of bowel cancer. And this question, I think, is really important because it kind of puts the cancer on its head a little bit. It kind of makes us see that we can have a little bit of control. We can go to screening, we can go to the doctors if we notice something, and we can have a say in what we eat and how we live our daily lifestyle. So that's what I get from this, and that's why I think it's so important that we do talk about cancer, because there are things we can be aware of in a positive way and do. Okay, so moving on. We've got 3 cancer screening programs in this country, only 3. There's over 200 different types of cancer, but these cancer screening programs, you are invited to. If you are registered with a GP, you are invited to them. And these are the 3. We've got breast, cervical and bowel screening, cancer screening. We do have other screening programs for other kind of health issues, but cancer screening, it's just those 3. So this is the mammogram machine. Emma, you were right. It's 2 plates, the carbon fibre, they're not metal, so they're not that cold. And breast screening or a mammogram, we know it's an x-ray. You're invited between the ages of 50 to 70 every 3 years. If you are registered as a woman, you will get invited. In some parts, it can be earlier, and you can carry on having it after 70. And you're either invited to the hospital or the mobile unit, which moves around. And yeah, if you've got a family history of it, talk to your GP and you might be able to have it earlier. That is cancer screening for breast cancer. And the signs and symptoms, these are exactly the same for men and women. I've got my lemons here because I think it just depicts a lot more issues that we need to be aware of. I think the majority of us think breast cancer lump, think that's it, but it's not it. It can be thickening, indentation, sores even. Now you might put sores or itchiness or dryness down to new washing powder, a different bra, some kind of irritation. Sometimes it's not. I think we're really, really good at coming up with reasons and excuses sometimes why we've got certain signs and symptoms, but it's really important that you are aware of the things to look out for. Okay. So retracted nipple, a vein, a bump, similar to a lump, I'd say, but maybe a bit smaller, leaking nipple, redness, hotness, hidden lumps. So any changes in your whole chest area, please go to your doctor. Now, I've got a little video about how to check, but I'm not going to show it you just for time and probably because it might not work. But the whole point of this is you know your breast. So I think we don't stand in front of the mirror. We're busy, we're doing stuff, aren't we? We don't really take time to stand in front of the mirror and look at ourselves. If we did that once a month, if we had a look and a check and a feel, we'd know if something happened or changed. So I would encourage you to know what is your normal and to take note of anything that isn't normal and get it checked, whatever it might be. Every GP would rather you go and for it to be fine than to you not go. Because if you're not going, it might get worse. It might be something worrying. It might not, but you might be worried. And I think sometimes the worry can create further health risks. And worry is a horrible thing. So please do not go worrying. Go to the doctors. There's different ways you can check yourself. There's different things online. There's different videos, which I'll pass on to Emma if you do want them. But again, it's what works for you. It's what you think is your normal, and you're the expert on that, aren't you? So leave that with you. Different organisations, they will text you. Copperfield and different charities will text you once a month to remind you to check yourself. They've got infographics as well. If you want to get a job lot, it's free, Emma. So things like that are sometimes worthwhile, just as a reminder. If you are caring for somebody else and the breast screening appointment comes through the post, you might need to maybe help make that appointment, help them get them to the appointment, maybe some form of dressing and undressing with the taking off of the top things. That's all you need to do. And then if you are going to stay in the room, if you're allowed to stay in the room, you might need to go behind the screen, obviously, while it's done, because it is an x-ray. But you do need to mention, if you want to support somebody you are with, please do ask and talk about it. I think sometimes health professionals just assume things sometimes. So do just be verbal and vocal and say what you're there for. I'm going to help. Can I help? Do you know what I mean? And try and explain the situation. Okay. So that's breast screening. And if you were to check someone else, it's quite a personal thing, really. So it's a tricky one, but exactly the same of issues, signs and symptoms. Okay. But obviously it depends on who you are in your relationship with other people. So I don't think that is called for most of the time. So that's the video which I won't show you at the minute, but I'll pass on. And the next one, we've gone from breast screening, now we're on bowel screening. This is the FIT test. That stands for fecal immunochemical test. Some people have come up with different acronyms for that, and they're quite exciting. What was one? Feces in transit, because you send off a poo sample, which I think fits it better, if I'm honest. And if this is positive, it's a colonoscopy you're invited to have. So these tests are for women and men, and the age limit is coming down. Well, it's coming to 50. By 2025, they want all 50-year-olds to be being invited for bowel screening. At the minute, 56-year-olds are being invited, but not 58-year-olds. Because the old screening age was 60 to 74, but that is coming down now to 50. So if you're over 50 and you get something in the post, do not worry. It's because the age limit's coming down, and it might be different in different areas. So that's what's happening. It comes through the post if you register with a GP every 2 years. And if you hit 74, it stops coming automatically, but you can still ask for it to come. You only need to do one sample. And again, it looks for invisible blood in your poo, like you said, and you send it back in the post. And then you might be invited for a colonoscopy. But again, it doesn't always necessarily mean it's cancer. It could be other things. This video is really quite good. It tells you how to do it. And just using a Chinese, like a takeaway tub, layer it with tissue paper. It's not simple, but it's doable. It's okay. And it just kind of makes you see how easy it could be, kind of thing.
I know, you're literally just catching your poo, aren't you? You're catching your poo in a tub.
Yeah, that's it. And then you get this little stick. It's tiny. It's not that big. It looks massive on there. And then you just scrape a little bit, not too little, not too much, just right amount in the middle, the Goldilocks technique. You chuck it back, stick it back in. Obviously, then you post it, like put it back in its tub. You wash your hands, and then you can obviously throw the tub away. But that's it. And I think this one is easier to do and help other people with, maybe, that you're supporting. Yeah. And if you're not due for bowel cancer screening because of the age, or because it's not the right time, it's really important we're still aware of the signs and symptoms. Okay, so blood in your poo could be a number of things, but it could be cancer as well. Like a feeling of a mass in your tummy or your back passage. Unexplained weight loss and tiredness. This could be a lot of different illnesses, but it's really important that you go to the doctors if you're having tiredness all the time, and if you're losing weight and you're not sure why. That can be a sign of lots of things, so you must get that checked out. Persistent unexplained change in your pooing. So everybody poos differently. We don't really like to talk about poo. Unless you've got small children, you don't really talk about it in your daily life, but some of us do. It's a change for you. And I think this is really tricky when you go to the doctors and say, you're trying to explain your bowel habits. It's embarrassing, first off, but everybody's bowel habits are different. So you need to make sure you explain why you're there and why you think your bowel habits have changed. So some of us go 3 times a day, which is bordering on diarrhea, I think, isn't it? And some of us go 3 times a week. So somewhere, apparently, we're all in between that, but everybody is different. Sometimes after a weekend eating different food, sometimes we do go in a different way. We all change every now and again. But if you notice a change to your normal, what's your normal? I don't know what your normal is. Go to the doctors. Also, if there's pain, discomfort, or bloating, that can be another sign. That can be a sign of lots of other things as well. But still, if it's making you uncomfortable, then you must go to the doctors. Again, it's hard to talk about bowel things, but it's important that you do mention it and do try and get some support with that. The last one is a constant urge, feeling like you've not finished when you've been, and feeling the urge, like that you have to do it there and then, kind of thing. That can be a sign or an issue as well. Okay, so that's the poo situation. That's what we need to look out bowel wise. Okay. So if you are helping someone else, or if you're caring for anyone else, You could possibly help with the poo sample if it's appropriate. Again, catch the poo, but then you don't catch it, the Tupperware catches it, and then you throw it away. You label the stick and then you pop it back in the envelope. It's a bit like when we had COVID the first time and people had PCRs sent to the house in those cardboard things. It's exactly like that. It's much smaller. Sometimes you need dexterity, to take it off. It's much smaller than like a mascara. So you've got to kind of twist and pull kind of thing. So that might be an issue. And what you can look out for yourself, other people, blood in the poo, going to the toilet more often, something's changing, pain, a lump, weight loss, tiredness. These are things we can possibly identify in other people. Pain's a tricky one though for other people because are they communicating it with us? We don't know. So there's things we can do in that way. And the last one, cervical screening. So this is really HPV testing. HPV is a virus, human papilloma virus. It's not to be muddled with HIV, it's completely different. Women who are aged 25 to 49 are invited for smear tests, these cervical screenings every 3 years. But if you're between 50 and 64, you're invited every 5 years. And it's done normally at your doctor's surgery, but there are some specialist clinics as well. Anybody registered as female or a trans man who has a cervix is invited for this. If you've had a hysterectomy, a full hysterectomy, you don't need one anymore. But if you've had a partial hysterectomy, you do. So I think sometimes that might be an issue or something that we might not be aware of. It's normally at your GP, and so it's easier to get to, I think. The issue here sometimes can be you have to ring up and get through to your GP to make that nurse appointment. And it should always be a female. It should always be a female nurse doing the test. And you should always be made to feel comfortable. If you want to talk about things beforehand, you can do, and you should do as well. If you want to see the instruments, they should show them to you. It's your choice. If you think you might benefit from taking someone with you, talk to your nurse. If you think you might want a double appointment because you don't want to be rushed, tell them when you're booking your appointment. These screening tests are really important. And so I think your doctor and your GP and the nurses would want you to say what your needs are rather than you feeling rushed or feeling like you can't do it on the day. It's about getting over our needs and our preferences, and you should always be made to feel like you're still in control. It's not a nice thing to go through. It is kind of vulnerable because you have to lie on a bed, and I think as soon as you lie flat, it kind of takes away your feeling of being in control of things. So it's not a nice situation. But you need to get that across. If there's something particularly you're worried about or something you think you won't physically be able to do, we need to talk about it to see if there's like things we can do to sort it out. Children, can I say children? Our 12-year-olds and 13-year-olds are being vaccinated for HPV. It's been happening for quite a long time now. And HPV is responsible for 99.8%, something like that, of all cervical cancer. So if the virus of HPV is there, it can lead on into cancer. So when you have a smear test, your letter, when it comes back, will say if HPV was present. If HPV is present, then they test the cells to see if they've started changing into cancer. If HPV wasn't present, then that's great. So HPV is responsible for most cervical cancers. So they do test for the HPV virus. Vaccinations in our 12 to 13-year-olds try and reduce the HPV virus. The vaccinations only try and do that for up to 10 years. It only gives that much kind of immunisation, but it only covers 70% of all the over 100 types of different HPV. So it's a good kind of measure, but it doesn't eliminate it altogether. So when you're female and you reach 25, you are still at the perfect age to get cancer screening, even if the cervical cancer, even if you've had that HPV vaccination. The HPV is passed on through touch, of genitals, hands, mouths, things like that. It's important then that we're aware of that when we're saying and thinking about who might be eligible and need cancer cervical screening. Every woman over 25 is invited. Okay. And this little video says a little bit more about it, but I think we'll carry on. And so then we've got loads of time for questions. If you're supporting somebody who would get a cervical screening letter, you might need to ring up for them to make that appointment. You might need to say about any needs or extra time. You might have to help with instruction or information. And possibly ask for extra support, I think that said. There are specialised clinics for cervical smears due to different experiences ladies have had. So there are a few that you can ask about if that's the situation as well. If you're not due your cervical smear, or if you're not 25, or if you're over 64, it's really important that we're aware of signs and symptoms of cervical cancer. And I think this is a tricky one as well, because signs and symptoms can be things like bleeding in between your periods, pain during or after sex, and unpleasant vaginal odour and discharge and pain. So sometimes we put these down to lots of different things, but if you're experiencing anything, you need to go and see the GP. Okay. Again, it's something quite embarrassing. We don't really like to talk about it, but it's really important that things are found earlier. If you do have discharge, sometimes it could be something else like a UTI. So it's important, again, to go to the doctors for treatment. But it's all about recognising the sign and symptom and getting to the doctors, isn't it? All right. So I think if you're caring for someone, obviously you can possibly, if it's your place, those are the things we could possibly look out for. But again, it's possibly difficult to detect if you are not part of that personal care of that individual. So at this point, we normally ask about what people's barriers to screening have been or are. And it's really interesting to hear people's feedback here. So if we've got time, Emma, would anybody pop in the chat anything that they think stops them or people they care for or people they know to go for their cancer screening, whether it's smears, bowel screening or mammogram? Each group sometimes comes up with different things. And from their own experience, it can sometimes be getting through to the GP. Timing, yeah, that's a good one, yeah. Some people have appointments cancelled. Go on, Emma.
I was just going to say I'd booked mine in and then my period was there and then I cancelled it and then it's another 2 months and sometimes you think you've done it. So
yeah, it's really hard. I always find it hard to remember when it was. So you should get that letter. If you think, because 3 and 5 years is a long time, isn't it, to remember? So if you think maybe I'm due, give your GP a ring. Lack of understanding, yeah, work, brilliant, yeah. All these different things. Frightened, yeah. Some people are frightened and it is easier to ignore certain things. But remember, this is a health check and it's a check. It can pick up other things as well as cancer. And the whole point message of anti-cancer is, if it's found earlier, it's the better prognosis. Now, I didn't say at the start, but Cancer Research UK believe that 1 in 2 of us will get cancer at some point in our lives. So it's important that we're aware of it and that we know what to do and we feel confident at doing that as well. Oh, good one, childcare, yeah. Embarrassed, yeah. Cost. That's an interesting one. Cost, like getting to the hospital, getting the parking ticket, all of those things. Yeah. Now, we're doing something else as well at Answer Cancer. It's a pledge and it's for employers to pledge to allow their employees to have time off for cancer screening. I think I thought that was done already, if I'm honest. But no, so I do think that is something you can find out on our website if you're interested. Pass it on to your employer. I do think embarrassed, yeah. However many times you have a smear, it's still embarrassing, isn't it?
It is, and I think like that first smear, you know, when you called up at 25, there's a lot of barriers there, I'd say, to going in.
There is. And it's so important that we feel we can talk and ask questions before, because it's not a nice thing. Even at the dentist, you're not that far back. Do you know what I mean? You're still kind of upright. And for me, that was a massive thing. I hated it so much. So yeah. Oh, thanks for that, everybody. That's really helpful. So what we do as well as a programme is we try and relay barriers, because sometimes we can have, and the NHS can have all these different ideas about why people aren't attending their screening. But unless we actually are talking to people and finding out what they are, and feeding that back, it's not going to change. So it's really interesting that we do this and feed it back. So thank you. Nearly finished. And then there's lots of questions, well, chance for you to ask me questions. So important message, if you're not due for screening and you think there's something wrong, you need to go to the doctors. What is your normal? You know that. Nobody else can really say what your normal is. Talking to your doctor, make sure you're ready, make sure you've written it down, be honest, why are you there? Anything you're worried about can have physical effects as well. So explain if you are worried, why are you worried? What has changed and what is your normal? And do be stubborn, keep going back. I think sometimes GPs will give you something. When you visit them, if there's something wrong, they will give you a prescription for something. If it isn't working, you are allowed and you must go back and get the thing that is working. Do you know what I mean? Sometimes, yeah, so it is a two-way conversation. You've not used up your amount of GP sessions in a month. You don't get allocated a number. So even if you've been twice with your children, you can still go for yourself, okay? Really important we do that. So the whole point of this for me is there are things we can do to reduce our risk, as well as cancer screening, going to our appointments. That's one thing we can do. We can take the time to make it a priority, to get the letter off the fridge and make that appointment. We can be aware of our bodies and go to the doctors if anything's different. And the final kind of thing we can do to reduce our risk is to try and be healthier. All these things, we know about these things. They're in the back of our heads. We've been told about them for years and years. Not smoking, trying to be a healthy weight, being active, not drinking alcohol, cutting down, not eating processed meat, trying to eat more fibre and fruit. We know about them, but it doesn't mean they're easy to do and easy to incorporate into our busy lives. But if you just look at these and just try and do a few, there's lots of help and support out there for cutting out smoking, for being healthy weight. There's lots of things going on, especially in Salford. There's things we can do. So just pick little things. Don't try and do a massive task all at once. Set yourself little things and try, because you're important. And these aren't just about improving your health, kind of stopping your risk of cancer. They are improving it, not stopping it, but they're about your mental health as well. Being more active, that's really good for your mental health. Smoking and cutting back on alcohol is good for your heart health as well. So these things are quite important for our overall well-being and not just about reducing cancer risks. Again, these are our messages. Can't go on about them enough, can I really? Cancer screening does save lives. It's important and you're important. And if it's unusual for you, please go and see your GP. And early detection does save lives and it improves the prognosis. So that's why we go on about cancer screening and try and nag people to go to the doctors, because it's important. Things found early can be so different and make a difference. So starting conversations, everybody can do that. Answer Cancer started years ago and it was kind of thought it was going to be like a social movement. People, everyday people, becoming champions, having a little bit of knowledge, or maybe they've got experience of cancer and they just want to talk about it. They want a conversation in their family, in their friend group, in their workplace. It was about that conversation starting and spreading, because I can only reach so many people, but you can reach so many more different people in your groups and communities. It's just about having that conversation, being confident to have it as well, because sometimes we don't want to offend people. We don't want to make people think of horrible things or experiences they've gone through, but it's just about talking about it. So we have champions, Answer Cancer champions, a little bit of training to help us do different things with our stalls, with our radio shows or whatever. We don't do many of those, or just helping with communication and things. And it's a way in which we can include people in this awareness raising, because it is important. And some people, especially if they've had experience of cancer, got such an important message, and when they speak, it's got so much more power, because it can sometimes mean something more to people and to motivate them more, because of that personal experience hearing about. These are the websites which are great. NHS, Cancer Research UK, for bowel cancer, it's Bowel Cancer UK, Breast Cancer Now, and Joe's Cervical Trust are amazing. They're about cervical cancer awareness, and they have videos and information in lots of different languages. The whole website changed into different languages. I cannot say how amazing they are. Breast cancer now have different leaflets in other languages too. And Macmillan Cancer Support, actual places where you can walk in and talk to someone, get information, leaflets, and take it with you. But they also have an online presence too. So that's kind of it, and that's my details. But if you've got any questions, please will you put them in the chat, and we can just see what you think and see if there's anything I can answer. Is that all right, Emma? Yeah.
That's brilliant.
Thank you. Shall I turn my screen off now?
You can stop sharing at the top, and then you get to see us in a bigger on the screen in bigger squares. Oh, lovely. That's so interesting. Thank you, Hannah. Really, really interesting. Loads of stuff there that I didn't know about. So
thank you. I really enjoy doing what I'm doing. It's just meeting so many interesting people and just reminding people that they are important. Do you know what I mean? Because I think we're just so busy with things, aren't we?
And that really comes over how you talk about it, Hannah, that we are important and we should make time for ourselves, because I think often we're, especially if we're caring for others, we're putting their needs first. We're not thinking about ourselves. So
yeah. And it's so hard caring as well. I think sometimes it's all consuming. So it's really important to remind anybody that is a carer.
Hannah, I'm just going to do the next poll.
Okay.
Don't touch anything.
Yeah, I won't touch anything. Sorry. But if you think of any questions in the meantime, do put them in the chat and I won't touch anything.
Don't touch it. Don't touch it. We'll just minimize that while people do it. So yeah, Claire says, your work to get employers to give people time off work for screening. Is this aiming for paid time off?
Yeah. So it's part of our pledge on our website. I think it's on there. So it shouldn't be taken out. It's to allow you. So it's mainly for women, really, I think, because of cervical and breast screening, because you need that appointment, don't you? Whereas bowel screening, you can do at home in your own time, and you can do it at the weekend, you can do it whenever. So it is for those appointments. And sometimes you don't want to cancel them, do you? Because then you have to ring up and then it becomes more of a kind of an issue, really, and there's more barriers that way. So yeah, it's called the Answer Cancer Be Screen, Get Seen. Get seen, be screen.
Oh, the other words that rhyme.
Be seen, get screened.
But basically just going and getting your screening done in work time.
Yeah. Yeah.
Fantastic. Any other questions to share? I'm showing you the results of the poll. So we've increased to good on the first one, still in the middle on the second one, and on our third question now we're very confident.
Yeah.
So that's good, isn't it, Hannah? That's what you want to happen, isn't it?
Yeah. It's just talking about stuff, isn't it? It's just important.
Starting those conversations. You know what I found really interesting when you were talking about, you sort of apologized about talking about cancer. Actually, we use cancer quite a lot when we're talking about dementia, because dementia is a much harder topic to talk about. People, I think, so in comparison, dementia's
that's really interesting you say that. Yeah.
Right. Any more questions or comments? Otherwise, I think we'll just say thank you very much to Hannah and bring this webinar to an end. I think you've filled all of our heads with facts and information, Hannah, so we do not now have any questions for you.
Well, you've given me a question as well now, so I need to double check.
Oh yeah, I did.
Yes, I know. Yeah, it worked both ways. Thank you so much.
Thank you so much for your time, Hannah, and thank you for coming on today. It's been a really, really interesting talk. I think it's given us all something to think about. I'm glad that I had my smear 3 weeks ago. Otherwise, I'd be sat here going, oh, no, I haven't had my smear. Another
Oh,
photo.
it's not about that. It's not about pointing the finger. It's just about, you know what I
Yeah.
mean?
Yeah, taking time for yourself.
A nice nudge. Yeah.
Little nice nudge. Lovely. I hope you have a lovely rest of Wednesday. Take care, everyone, and I'll see you soon.
Thanks, everyone.
Thank
Thank
you.
you. Bye.
Bye-bye.